We want to thank you for joining us for this Hurley Healthy Living event. Millions of people are treated each year for hernias in this country. Right here in our region, you have access to surgeons from a designated center of excellence. We're not only going to share what that can mean for you in your surgery, we're going to give you information you need about types of hernias, symptoms, and treatment options. We want you to feel confident in your treatment plan, and above all, we want you to feel better so you can enjoy your life. What's great is you can get your questions answered right now, live, without an appointment. You can text me, don't call, 248-935-2562, or submit your questions on YouTube and Facebook. Dr. Adam Howell is going to dive into the different hernias, symptoms, and treatments. Dr. Howell is fellowship trained not only at Hurley, but also at University of Central Florida, HCA Ocala. His expertise is in surgical critical care and trauma surgery. Dr. Howell?
Thanks. Hi, my name is Dr. Adam Howell, and again, I'm here to talk about Hurley Medical Center Hernia Center of Excellence, which is the only hernia center of excellence in the region. This is made up of me and my partners, which include Dr. Christopher Wong, Dr. Gul Sashwani, and Dr. Patrick Beer, and myself. So just a little bit about me. I'm part of the Hurley's Comprehensive Surgical Group. My areas of expertise are surgical critical care, trauma surgery, and general surgery. I'm originally from West Virginia. I did medical school at the West Virginia School of Osteopathic Medicine. I then came up here to Michigan and did my residency locally at Ascension Genesis Hospital. After that, I spent a year down in Florida where I did my surgical critical care fellowship with University of Central Florida at their newly level 1 trauma center. And then I came back to Michigan where I did a year of trauma surgery here with Michigan State University at Hurley Medical Center. So when we're talking about a hernia, so we should ask, what is a hernia? Essentially, a hernia is a defect in the abdominal wall through all layers. And what this does, it allows a hernia sac to protrude. A hernia sac is basically the inner lining of our abdominal cavity and it's called the peritoneum. So sometimes this can include fat from the inside of our abdomen or other organs. Hernias have been present basically since the beginning of time. They've been discussed by the Egyptians back in 2500 BC. They were even mentioned by the ancient Greeks in 400 BC. At that time, there was no real good repairs, and if these got strangulated or if the contents popped out and the blood supply got cut off, then this was essentially a death sentence at that time. So who gets hernias? Everyone can get a hernia. Anyone can. Men have a lifetime risk of about 27%, and females have a 3% risk of getting a hernia. Healthcare professionals diagnose up to about 5 million hernias a year, and up to about 750,000 of those will require surgical treatment. There's multiple different kinds of hernias, and there's multiple different causes of each one. So how might you know if you have a hernia? So some of the signs and symptoms that patients typically report are they may or they may not have pain over that region. Typically there might be a visible or a palpable lump, whether that's down in the groin, around your belly button, or anywhere on your abdominal wall. And this usually comes when, again, that fatty tissue from inside the abdomen is protruding out. And over time, as this hernia gets bigger, then the abdominal organs or our bowel can pop out of that as well. Again, people will typically complain of increased pain that occurs primarily at the end of the day. They'll have burning or maybe a gurgling sound over that bulge. The pain and discomfort can occur down in the groin or, again, anywhere on your abdominal cavity where that hernia is. It usually gets worse with increased pressure, so if people are coughing or they're bending over or they're doing heavy lifting, and they may even report a heavier dragging sensation in those areas. So like I'd mentioned before, there's multiple different types of hernias, and when we talk about them, it's usually based on their location. We have epigastric hernias, which are typically in the upper part of our abdomen, umbilical hernias, our inguinal and femoral hernias, ventral hernias. We have hernias that are inside of our abdomen, like our hiatal and paraesophageal hernias. We have sports hernias, and then we have these large or giant hernias where there's a complete loss of domain from your abdominal cavity. And this is basically a picture of what a hernia might look like if you were looking at yourself. Again, we have our epigastric, our umbilical, and then our inguinal and femoral hernias. Another type of hernia would be an incisional hernia, and these typically happen after patients have had a surgery before, and usually it's underlying that incision. For some reason, whether it's the patient's medical comorbidities or some issues related to the surgery, the abdominal wall doesn't heal correctly, and that can allow a hernia over time. And as time progresses, these can get bigger, they can become more painful. Our ventral hernias is just what we classify for hernias that are just anywhere along the anterior abdominal wall. We can have congenital hernias, which are essentially hernias that have been present since birth. We can have, again, the ventral hernias that can be anywhere along the abdomen. Patients report these usually if they have medical conditions like diabetes, obesity, smoking, or if they've had long steroid use or any issues with malnutrition or wound healing. Our inguinal hernias, these are located down in our groin. There's several different types. Again, people will complain of a bulge or pain or increase in size typically after heavy lifting. The biggest risk of these kind of hernias, or the things to worry about, is that the bowel can pop out from these hernias and they can become incarcerated or strangulated. And what we mean by that is they get stuck, and then they get swollen, and then the blood supply can be cut off to the bowel, and then that can basically you would get really sick and need an emergent surgery. And as I'd mentioned before, our hiatal hernias, these are hernias that occur basically between our abdominal cavity and our chest. And typically there's a division where the diaphragm sits. Well, with a hiatal hernia, the stomach can slide up into our chest, and this can cause us to have symptoms of acid reflux that basically is not being controlled with medications, and this can also cause you to have increasing respiratory issues if you have COPD or asthma. It can even cause an obstruction, and then patients might have issues with nausea or vomiting. Then we have our sports hernias, which develop in patients who are obviously more active, are making quick movements, and occur where our muscles meet the pelvis. And finally, we have our loss of domain, or our giant hernias, and these typically happen in more obese patients or patients who've had multiple surgeries or even multiple hernia repairs in the past. So what are the goals of a hernia surgery? We really strive to get patients back to work quickly and back to their daily activities, to limit their postoperative pain, to decrease the risk of recurrence of a hernia, and to decrease the risk of any sort of postoperative infection. So what do we offer here at Hurley? We have a variety of different techniques to repair all these hernias. We can do the old school open hernia repair where we make bigger incisions. But now we're doing more minimally invasive techniques. We have a comprehensive hernia repair team, and this includes not only our surgeons, but our nurses and our anesthesiologists. And with this team, we help come up with the right surgery for you, because all hernias are different, all patients are different. And when I discuss these minimally invasive repairs, we're primarily talking about our robotic repair. So why would anybody choose a robotic repair? These have been shown to have less short-term pain. There's smaller incisions to repair these hernias. Patients will typically have a faster recovery. They'll have shorter hospital stays. They'll have a quicker return back to their normal activities. You'll have minimal scarring, and you'll have less long-term pain as well. When we're trying to fix these hernias, whether it's in an open approach or whether we're using the robot and minimally invasive, we always like to try to use a mesh this helps reinforce that repair and decrease the chance of recurrence. There's a lot of stigma or myths about hernia mesh. Some people think mesh is bad, or that it causes pain, or it causes a recurrence, but that's not true. And actually, these help patients heal. Some people will request tissue repairs without mesh, but only certain people can actually receive those kinds of repairs. So, do we have any questions from the audience?
We do. And it's not too late. If you do have some questions, you can still text them to me, 248-935-2562, or you can just submit those on YouTube and Facebook and we'll get them. Can you live forever with a hernia if it doesn't hurt or grow?
Yeah, you can continue out with any repair, with any sort of surgical repair. But again, a lot of people will start to develop pain, but you are putting yourself at risk for, especially if the contents are your bowel, that it could become strangulated, it could become or incarcerated, and that would be a surgical emergency.
Mark says he has a bump and he wants to know, could it be something else besides a hernia? It feels like a hernia, but are there other things that present with the same symptoms?
Yeah, there are multiple causes of bumps, whether it's on our abdomen or in our groin. And if that, if somebody's concerned about that, then that's something that they should come in and have looked at, and then further diagnostic testing would help determine whether that is a hernia or whether that is something else.
We have a couple of questions just about the surgeries themselves. So is it a hospital stay, or do you do them outpatient, or?
Sure. So this would just depend on what kind of hernia we're fixing, primarily the size of it. If this is a simple inguinal hernia or a small ventral hernia, then these can be done electively and in an outpatient setting. So typically the patient would come in, they would have their surgery, and once it's complete, after they wake up from anesthesia, then they can go home. Some of our bigger hernias, those might actually require several days in the hospital to make sure that their pain is well controlled, they're eating, and they're doing well before they can go home.
And then what's recovery like? Are you off work? How long does it take before you can get back to your life?
Yeah, so we usually say that a patient should have several weeks of minimal activity. They don't want to go right back to work and have heavy lifting. But after those weeks are over, then they can typically go back to their normal activities.
Is there a difference when you use the robot? I mean, how much better is that as far as recovery time goes?
Sure. Yeah, so the recovery time is less, but the advantage is that, again, we can use smaller incisions, and if we're fixing an inguinal hernia, we can actually, at that time, take a look at the other side, and if that needs repair as well, then we could do that during the same surgery. So instead of having larger surgeries, we can use smaller incisions and even have the potential to fix multiple hernias at one time.
And then you did touch on this, but could you talk a little bit more just about how you have so many more options, to choose from, because at Hurley you're working with a team of people and they can kind of explain everything and present the different ways. And
yeah, so with our surgical group, we can, as a team, look at these all these hernias, kind of just come up with the best plan, what the best surgical approach, whether that would be a open procedure, or if we can hopefully fix this robotically in a minimally invasive procedure.
It's almost like getting a second opinion, but the second opinion's already there.
Yeah.
All right, cool. Thanks so much. We hope this was helpful to you, and the Q&A answered any concerns you have. If you're looking for shorter hospital stays, faster recovery, minimal long-term pain, Hurley is probably the answer you're looking for. You can make an appointment with Dr. Howell by calling 810-262-6024, or you can reach the director of our hernia center, Dr. Wong, at 810-262-6555. You can also head over to hurleymc.com for more information. We do want to thank Mid-Michigan Now, our great broadcasting partners who help us bring these events to you live. Thank you, everyone. Have a great day.